Hi, everyone. Good morning, good evening. My name is Maya Hamad. I'm a researcher at the International Policy Center for Inclusive Growth and the moderator for today's webinar on emerging practice on coverage and inclusion of migrant workers in social protection systems in Asia Pacific during COVID-19. This webinar is organized jointly by the Asian Development Bank and the International Policy Center for Inclusive Growth, with support from socialprotection.org. I would like to start by inviting Wendy Walker, one of the organizers of today's webinar, to give us a bit of a brief about the background for this webinar. Wendy is the Chief of Social Development Thematic Group at the Asian Development Bank. Wendy, please, the floor is yours.
Thank you very much, Maya, and thanks everybody for joining today. We are hosting the event under two different auspices. First, as Maya said, this is our second collaboration with IPCIG and socialprotection.org under a new joint initiative to develop the Asia and Pacific online community. The webinars and other outreach efforts aim to share experience from and promote learning about social protection systems and programs in the region. And you can find out more about the discussion group on the socialprotection.org website. The second is in our current role as senior chair of the MDB working group on economic migration and forced displacement, which we are holding as a rotating chair. This working group seeks to share knowledge and approaches across the MDBs and build collaboration. We're hosting 3 webinars on different issues in migration in the region. And this webinar is the second in that series. And the Inter-American Development Bank is also the junior chair at this time. Today, we will highlight emerging practice and policies from directions for coverage and inclusion of migrant workers in social protection systems in Asia and Pacific. Throughout the current COVID-19 epidemic, we have all seen how important these issues are globally and how much inadequate social protection coverage has affected different vulnerable groups, particularly migrants. We're delighted today to have our colleagues from ILO, the Asia Foundation, and ADB to share their recent research and experience and welcome audience questions at the end. We have a very full panel today, and I think going to be a very interesting discussion. So with little time and no further ado, let me quickly hand back over to Maya, who's our very able moderator, to introduce the speakers and further set the context for the webinar today. Thanks very much. Over to you, Maya.
Thank you very much, Wendy, for giving us this background and introducing the webinar series. I would like to begin by stressing how important and significant the coverage and inclusion of migrant workers in social protection systems has become after COVID. Migrant workers' engagement in the informal economy and their exclusion from national social protection programs on the basis of nationality meant that they were excluded from emergency social protection programs and were thus extremely vulnerable to stay-at-home and lockdown measures, as Wendy, you mentioned. Since March 2020, the International Policy Center for Inclusive Growth has been mapping national social protection measures in the Global South in response to COVID, including social assistance, social insurance, and labor market measures. The dashboard, which is going to be live on socialprotection.org, has almost 900 measures, but unfortunately, the majority of those are exclusionary to migrants as they require national IDs for registration or payment disbursement. But at the same time, COVID has been a window of opportunity for policy change in countries to expand coverage and include migrant workers. In Colombia, we've seen Venezuelan migrants with work permits, even expired ones, being able to benefit from emergency social assistance programs. In South Africa, citizens, permanent residents, as well as registered asylum seekers were able to benefit from the COVID social relief distress grant. In Jordan, the Social Security Organization introduced 3 emergency social insurance and labor market programs that were designed to allow migrant workers from Egypt, Syria, and other countries, as well as certain categories of Palestinian refugees to benefit. And noting that migrant workers are often working in the informal sector, countries such as Kuwait provided migrant workers with emergency cash and in-kind assistance. Also, in some countries, we've seen healthcare treatment and free COVID testing. This was seen in Qatar, Saudi Arabia, and some Gulf countries. In Saudi Arabia, COVID testing and treatment was provided to all migrant workers, regardless of migration status, which is also a very important point. In a recent webinar on socialprotection.org, UNICEF Egypt and the World Bank and the IPC presented interesting findings related to the question of the inclusion of migrants after COVID. Research from the IPC showcased the importance of having strong legal frameworks based on a human rights-based approach that extends social protection to all without discriminating against those of different nationalities. Research presented from the World Bank based on the case of Brazil, where social assistance, social insurance, and labor market are available to all regardless of migration status, however, showcased that inclusive legal frameworks alone may not automatically lead to better inclusion of migrants. Some of the hurdles to inclusion that were seen in the Brazil case was language barriers, occupational downgrading, and the density of the migrant population in specific territories, also xenophobia. Building on examples from my home country, Jordan, and the emergency social insurance measures that I mentioned prior, early research conducted by labor law and social security activists was showcasing that the eligible non-Jordanians to these social insurance programs were actually facing extra challenges in accessing their benefits. And this was through double or triple the waiting time of Jordanian workers, and also the prioritization of their Jordanian counterparts by the Jordanian employers. And it was noted that the mid-level management was playing a significant role in exacerbating this exclusion or facilitating its continuation. So as we've seen, researchers already looked at the inclusive legal frameworks and how important they are, but also how they could fall short of providing full inclusion. This webinar, however, will be shedding light on something different and looking at the Asia-Pacific region, focusing on increasing inclusiveness through the role of regional cooperation networks, looking at economic zones and the concept of portability. We have a panel of 5 distinguished speakers today who will be presenting 4 different presentations. We will begin with a presentation from Nuno Cunha, who is an economist with a specialization in public policy and is currently the social protection senior specialism of the Decent Work technical support team for East and Southeast Asia at the ILO. Nuno will be presenting the legal basis of social protection rights for migrant workers as is passed by the ILO's different conventions, and will touch upon what bilateral agreements entail and the concept of portability. We will then move on to a presentation by Nicola Nixon and Nuk Suponic from the Asia Foundation, who will be looking at the situation of migrant workers in the region during COVID. Nicola Nixon is the Foundation's Director of Governance, leading programs in 18 different countries and 3 sub-regions of Asia. Nuk is the Regional Program Manager of the Asia Foundation in Bangkok, managing Southeast Asia regional programs. We will then move on to a presentation from Azusa Sato, who is currently a policy fellow at the Center for Global Development on secondment from the Asia Development Bank. Azusa will be giving us an overview of ADB's support for mobile and migrant populations. Finally, we will conclude our webinar with a presentation by Eduardo Banzon, who is the Principal Health Specialist in the Southeast Asia Regional Department of the Asian Development Bank. Eduardo will be looking at the access to vaccines and health services for migrants during the COVID pandemic. Following these very interesting presentations, we will have a very long Q&A session. So I encourage you to send your questions through the Q&A button at the bottom of the chat. Please indicate which panelist you would like to address your question to, as well as which organization you're from. And now, without further ado, I will give the floor to Nuno to start giving us his background presentation. Thank you very much.
Thank you. Thanks, Maya. And thank you also, of course, to ADB and socialprotection.org for the invitation. I will go, it was very interesting, the points you made about COVID. And I think indeed, all these made something that was a little bit more invisible and made it more visible. It's the same that happens a little bit with those working in the informal economy, but also with migrant workers. And I'll give kind of a step back and start talking a little bit more about why they need to be protected and what are the tools to ensure protection. Next slide, please. The first one is, of course, I could not start without mentioning. It's basically social protection is a human right, for everyone, and therefore, I mean, we cannot exclude anyone because of nationality. Then it's very clear from also international labor standards like Convention 102 that everyone, that there should be no discrimination clauses within Social Security legislation. And this applies for all the branches of Social Security and means basically that all non-national residents must have the same treatment as national residents. And there's a lot of debates. I've been involved in discussions at country level, meaning like trying to bring this to the level of subjectivity, what means equal treatment. And basically it's about equal obligations, and means in terms of contributions, and equal rights when it comes to benefits. And next slide, please. And the ILO has quite a framework of international labor standards that deal with this issue. Means there is looking at equality of treatment of non-national residents from an overall perspective for all the branches, but it also goes more in detail in some particular branches. And then also in terms of defining, in terms of specifically defining, in terms of maintenance of rights, and even going in terms of recommendations on how multilateral or bilateral social agreements should look like. Next slide, please. However, there is, of course, I mean, and this is important because these discussions, even in developed economies, they are very common these days, is who should have access. And I mean, there are some flexible elements, even in international labor standards, like accepting some principles, like when, for instance, the funds are from taxation and not from contributions, or with some parts of some sort of benefits, of course, which are more difficult to implement directly. But I don't have, unfortunately, the time today to enter in detail, neither to enter in this discussion. It is a complex one. It's not because there are an exemption in the convention that means that it should not be promoted. Next slide, please. But beyond the issue of rights, and beyond the rights, particularly from a migrant worker perspective, from being protected, there are also benefits for the host countries. First, because migrant workers, they improve the demographic situation. I mean, especially in Asia and Pacific, with many countries aging, but still other countries with very young populations. This is just a normal way of balancing the needs in terms of labor markets. Next slide. But then and this, for instance, is in the country I'm currently based. It's a very important discussion because Thailand has a large number of migrant workers. But if the migrant workers are not covered by Social Security, it's kind of difficult to convince those that are residents to be covered, because that will create unfair competition. I mean, the cost of someone who registered in Social Security who is Thai will be much higher if someone who is not Thai is not responsible for doing the same contributions. There is a way. It's important to ensure that people are enrolled in Social Security, also to promote this issue of the perception of nationals in relation to the migrants, but also to create equality between the two in terms of ensuring that the lower price or the lower cost of labor don't result actually from different costs related with Social Security. Next slide, please. But what happened? Unfortunately, we see what is the situation of migrant workers. Many times they are in the informal sector. It means that even if they will be national, they will have challenges to be covered. They have short careers in the host economy. They change frequently from jobs. They are separated from dependent family members, making like benefits like family benefits more difficult to implement. And they work in areas like construction that are often not well covered even for nationals, or they are in very vulnerable jobs like domestic workers, what makes coverage, extension of coverage for migrant workers even more difficult, even when there is willingness or the political willingness to cover them. Next slide, please. In addition, there are, of course, administrative procedures that are difficult. There are language barriers. There are the need to coordinate with different agencies. Many times there are recruitment agencies that are involved. There are third parties involved in the recruitment process, but also then in the way the workers are managed in different countries. Many times they don't, for instance, if they're in the construction sector, they don't work for the contractor directly. There are the issues of records, how we ensure that we know the contributions that were done in different countries. All this creates additional burden and additional challenges that are not always easy to overcome. Next slide, please. And then there are, as I mentioned, I gave some examples. I think domestic workers are a good example. Again, for instance, in Thailand, domestic workers are basically excluded from the mandatory social security, and they can be covered in the voluntary article. But however, this article excludes foreign workers. That means that in practical terms, they are excluded. The same thing happens, for instance, in terms of seasonal workers in agriculture. They are basically excluded from the mandatory, and because of being foreigners, they are excluded from the voluntary. And what makes, in practical terms, actually, even if it's not written in the law, and the law says that migrant workers are covered and there is equal treatment, there are some elements of the way the details, the social insurance laws are defined that exclude them. The same thing comes when it comes to non-contributory benefits like child grants, where many times the rules of, for instance, of the visa that the parents have, they will not allow them to be legally with the children in the country, which makes them in practice being excluded from that kind of benefits, even if they would be included from a legal perspective. Next slide, please. Then this is big part of the discussion, is the discussion on portability. I always stress before discussing portability, it's very important to ensure that people are part of the system. They can only take advantage of portability if they are first integrated in national system in the country where they are working. But then the idea of portability is about preserving rights, independent of the place where they are, maintaining and ensuring the transference of rights when people move from one country to another. Next slide, because I like to speed up to ensure I stay within my 10 minutes. And then you have to make these to ensure these rules, these rules between and these agreements between countries are in existence, and there are, and all these elements are well defined. You need, of course, to have bilateral. Bilateral is when an agreement is between two countries, or some regions, they have multilateral social security agreements. Of course, multilateral social security agreements are more complex to reach. Let's say it's more easy for two countries to agree than, let's say, for 10 countries to agree. But of course, the powerful element of multilateral agreements is that they push more countries to agree on the same rules and to be using same rules. What can be important, especially in spaces where you want to promote mobility. The case of European Union is a good example where these kind of measures are in place, and they are essential to ensure and to facilitate labor market mobility. Next slide. And what are the key objectives? Next slide, please, of these agreements. Equality of treatment, I think I already mentioned this, but defining very well what are the rights and obligations, and what are the rights and obligations in different countries. I mean, it's also important to define that if someone is obliged to pay contributions in the country where he's working, it's important that his own country is not obliged also to contribute to its own social security. Then it's really important to define, if you are in a certain country, what legislation applies, and the countries agree on that. And in some cases, it's the way around. For some workers, that will be for a very short period, and working for a multinational, for instance, many times they keep contributing in their own country, and this needs to be defined on these agreements. The second element is totalization of benefits. For instance, I will be quick. If you have some countries, you need, for instance, to get a pension, you need to have 15 years of contribution. If you are, let's say, 7 years in one country, you will not reach these 15 years there. You are 10 years in other country, you also will not reach the 15 years, and you will not reach the what you need to get a pension. But if you have an agreement that brings the two contributions together, you can actually have an entitlement to receive the pension. And this is quite important when people distribute their working career in different years. And finally is the issue of administrative assistance. I mean, it's about ensuring how do you do when you go back and, for instance, you have an invalidity pension, how do you ensure that the person should still benefit from the pension, or even that the person is still alive, for instance, to receive an old age pension. It's very important because it's very difficult without this kind of agreements to actually be doing payments outside of your own country. Next slide, please. And that's it. I hope I stayed within the limits. Looking forward for your questions, and thank you very much.
Thank you very much, Nuno, for this very informative introduction to social insurance laws, and also the concept of portability and the important elements for its implementation. We will now move to a presentation by Nicola and Nook from the Asia Foundation, who will be presenting on the situation of migrants in the Asia Pacific during COVID-19. Over to you, Nicola and Nook.
Thank you very much, Maya. Thank you also, Wendy, ADB colleagues, IPC and socialprotection.org for the invitation to speak today. It's a pleasure to be here. Nook and I will speak briefly about some of the research and thinking that the Asia Foundation has done in this area over the past 12 months in particular. Like all of you, we became very aware early on in the pandemic just how important the issues and challenges facing migrant workers were and would be to pandemic response and recovery efforts. So our observations here draw on a couple of recent pieces of regional research, one in ASEAN and one in Asia more broadly, and some analysis that I'll speak briefly about today and then pass over to Nook. So next slide, please. So this is the first piece of research that we did early on in the pandemic. In mid-2020, on behalf of the ASEAN Secretariat, we undertook a rapid assessment of the impact of COVID on livelihoods across Southeast Asia. We looked in particular at access to social protection, labour and education as periods of lockdown and various social distancing and movement restrictions began to be put in place. The study focused on the impact on the poor, the most vulnerable and marginalised, of which migrant workers were one key category. The aim was to support the Secretariat in an evidence-based response to the pandemic as it was developing. It was followed up by a series of webinar discussions with representatives of ASEAN member states, and it looked in particular at the range of different measures that AMS governments were taking and could take to provide support to all those vulnerable to economic lockdowns, in particular some of the measures being put in place to improve or to try to improve social protection systems. We argued that migrant workers should be included in short to medium response measures in their destination countries, and that's obviously where we saw some of the most dramatic impact on migrant workers in Asia in particular in the early part of the pandemic. And this was especially the case if they were losing their jobs and unable to return to their home countries. This would have health and economic benefits not only for migrant workers but also for the host country. We saw a number of situations in which particularly informal migrant workers were excluded from healthcare services, and that in and of itself contributed to the spread of the pandemic. We noted some efforts in this direction to improve the situation for migrant workers. Singapore established protective measures for migrant workers. We have to say, after there was a fairly controversial series of reports about the treatment of migrant workers in Singapore, that those measures included bearing the cost of COVID-19 testing and treatment. Malaysia introduced a subsidy for employers for each foreign worker sent for COVID screening, and amended regulations on employer-provided housing for migrant workers to specify minimum space requirements, etc. So while small, these were some steps in the right direction. A key recommendation of the study was that ASEAN should further pursue both labour migration and social protection policies in a more coordinated way that would better protect migrant workers. Next slide, please. Now, none of those points will be unfamiliar to an audience here at socialprotection.org. The audience of this work, of the Asean Rapid Assessment, was primarily government representatives and the wider Asean public. In the publication, we also argued that social protection systems needed to be made more shock resistant, on the one hand, able to broaden and deepen their coverage, and that they needed to be strengthened in terms of their connection with other areas of policy such as health, education and labour. We did notice some other efforts to provide greater support to migrant workers during COVID, for example, through strengthened social care services. While at that time systematic data on spending and coverage wasn't available, I'm very interested to look at the dashboard that IPC has put together on some of the measures since then. However, several countries reported increased allocations for institutional care, and they were providing temporary accommodation and meals for the homeless, including homeless migrant workers, for example, in Malaysia and Thailand. Most countries, or many countries, also introduced some form of psychosocial and counselling support for vulnerable groups, and in some cases these were extended to migrant workers, for example in Indonesia and Singapore. We highlighted the importance of access to healthcare during the pandemic, in particular, as I said, for undocumented migrants. Among the recommendations, we emphasised the need at national policy levels to include migrant workers in receiving countries in the design of response measures. And we noted some measures in the Philippines and Thailand, for instance, in which governments had provided help to return home. But the lack of support and engagement in destination countries was quite troubling. Next slide, please. So more recently, and considering that as the issue progressed throughout 2020, we looked more broadly across lower middle income countries in Asia and drew on our experience, our programs and the knowledge of our country officers to produce this analysis of the impact of returned migration, reverse migration during COVID on countries of origin, in particular lower middle income countries. So this study, more than the sum of their remittances, covers not only the economic impacts but also social impacts of the shock of mass return migration during COVID. And as the title suggests, return migrant workers need to be considered by policymakers as more than the sum of their remittances, also valued for the skills, ingenuity and potential that they bring back to countries of origin. We looked at some of the additional challenges returnees faced in their home country economies and societies specific to COVID. So, for example, heightened discrimination, which has already been mentioned, heightened by the fear of COVID-19 transmission across borders. We also looked at gender discrimination, unique to women migrant workers returning. The lack of services in home countries because of limited or overwhelmed support systems, and severely decreased employment opportunities for returning migrant workers to countries of origin. We explored how governments, international and local civil society organisations and migrant workers themselves have responded to some of these challenges, and how that response largely falls short of the tremendous and unprecedented need brought about by the pandemic. We outlined how governments and civil society can better meet the needs of returning migrant workers through the collection of better data, through more accessible services, and inclusionary government policies that utilise migrant workers' skills, ultimately building a stronger support system behind migrant workers and enabling a lucrative economic backbone in both home and destination countries. And there's just 4 areas in which we've focused some of our recommendations. And just briefly then, if you go on to the next slide, we also noted, particularly because we were focusing on return migration, that improvements in the migration policy cycle are quite urgent. I'm sure you're all aware of the fact that most of the emphasis in LMICs tends to be in the front end of the policy cycle with preparation for migration, an emphasis on journeys to destinations and the ability of migrant workers to get jobs, and the emphasis in the policy cycle fades out after that with fewer measures and fewer budgeted initiatives. So national policies often fail to consider both the challenges and the opportunities presented by returning migrant workers. We argued that outdated and sometimes narrow-minded ideals inform policies which can tend to dehumanize migrant workers as merely another export, as so-called migrant stock. Prejudice towards migrant workers is especially common in destination or recipient countries, as we know, but it also occurs in migrant workers' home countries. And this has only worsened during the pandemic, further compounding the difficulties returned migrant workers now face. So our first study, as I said, focused on the ASEAN member states and the response of ASEAN member states to COVID and the pandemic and its impact on livelihoods. In the next part of our presentation, Nook will look at the evolving perspective of ASEAN and some of the issues around portability that have already been mentioned. I'll hand over to you. Thank you, Nook.
Thank you so much. Thank you so much, Nicola, and good morning and good afternoon, everyone. Based on, can you go to the next slide, please? Thank you. Based on our partnership with ASEAN for the ASEAN Rapid Assessment and some follow-up, we want to share some of our observations on the development at ASEAN level on social protection and migrant workers and some future trends. We see from our rapid assessment research that promotion of social protection for migrant workers have long been on the agenda of ASEAN. For example, in 2004, in the context of ASEAN integration, ASEAN also mentioned the work towards social protection measures to provide a minimum and uniform coverage for skilled migrant workers. In 2007, ASEAN Declaration on the Rights of Migrant Workers and the subsequent consensus in 2017 also commits ASEAN member states to intensify efforts to protect fundamental rights, promote welfare, and uphold human dignity of migrant workers. But more specifically, in 2013, ASEAN Declaration on Strengthening Social Protection recognized that social protection is a human rights issue, and everyone, including migrant workers, are entitled to have equitable access to social protection. So even before COVID pandemic happened, we already observed that there are several regional efforts to act on these many declarations and high-level documents. And these also, and they informed our rapid assessment. For example, from 2016 onward, social security coverage for migrant workers has become one of the priority areas of ASEAN cooperation on labor. Activities are mostly studies. We have seen ASEAN studies on social protection and migrant workers, as well as one study on feasibility of social security portability, which is these are done in collaboration with ILO. There is also a very recent ASEAN study on laws and policies in the management of migrant workers, which takes stock of social security coverage for migrant workers with different skilled levels and work permit arrangement. So in a way, social protection for migrant workers are seen from the lens of both human rights and from the lens of labor mobility for ASEAN. Now, during COVID, we observed that ASEAN has been reaffirming of the commitment to ensure that migrant workers have access to benefits that they are entitled to. And this has also been discussed in various platforms, for example, at the ASEAN Forum on Migrant Labors, which our team also present on the rapid assessment. We also see for the future trend, we see that social protection for migrant workers, including the issue of portability, will continue to be on ASEAN agenda. Encouragingly, follow up to the portability study, which I believe is about to be finalized, is also part of ASEAN comprehensive recovery framework and implementation plan for COVID recovery, although there is still no clear deliberation by ASEAN on what exactly to be followed up. We are also of the view that regional action will continue to be incremental and non-binding. A lot of time it will be on sharing of experience and setting up loose and voluntary framework and guidelines. This won't be a surprise to anyone here, given the complex and diverse laws, system, and coverage that each country has. Not to mention other challenges such as on administration and other that Nuno mentioned earlier. Apart from the challenge, there is also no political agreement among ASEAN leaders at this very moment to create ASEAN social security agreement. So such regional agreement remains a long-term expectation. But despite that, there are also some promising incremental steps that ASEAN will be taking that will contribute to, and it will contribute to better protection of migrant workers in a foreseeable future. We see, for example, there is a plan to develop a regional guideline on memorandum of cooperation on portability in the current work plan of ASEAN Committee on Migrant Workers. The committee will also lead the development of voluntary guideline for protection of migrant workers in time of crisis. And we see that there can be an opportunity to include social assistance, access to health, and then access to other benefits for migrant workers in this guideline. For last example, there is also an ASEAN guideline on effective return and reintegration that has recently been finalized. We observed that in recent years, more attention has been given by ASEAN on issue of return and reintegration, which used to be one of the most forgotten steps in migration cycle. The sudden return of migrant workers during COVID definitely accelerate the importance of this issue. And the promotion of social protection, as well as collaboration to recover contribution and promote portability is also part of the guideline. In sum, there's a lot of opportunities for ASEAN to continue to work slowly on the issue of social protection. These incremental efforts at the regional level can also mutually be reinforced by bilateral and unilateral efforts, which are also very critical, and Nuno mentioned this earlier. We see that bilateral social security agreement or MOU between migration corridors are very promising within the region, although it will definitely take time. There are already some work ongoing in the mainland Southeast Asian countries. Unilateral measures, on the other hand, done by both country of origin, such as the establishment of overseas migrant workers welfare fund, or those that is done by destination countries, such as by removing national discrimination or expanding coverage to those migrant workers in informal sectors or migrant workers with different immigration status, are also very critical. Just to sum up, that we see that ASEAN will still provide a central platform for member states to share their bilateral and unilateral experience, and then binding all this together. All of these at 3 layers, regional, bilateral, and unilateral, will contribute to a better governance of migrant workers in the region. Thank you very much.
Thank you very much, Nicola and Nuc from the Asia Foundation, for a very interesting presentation that looks at the importance of social protection, not only in the destination country for migrant workers, but also in the country of origin, which is, as was mentioned, often the part of the policy cycle that's always forgotten. Let's move now to a presentation by Asusa Sato from the Asian Development Bank and the Center for Global Development. Susa, I leave the floor to you.
Thank you very much. Thank you for your kind invitation and the introduction. I would like to present ADB's experience in supporting mobile and migrant populations, particularly from a health angle. Although we do a lot in social protection angles, my expertise lies in health, including a look back at the changes in the nature of support over the past few decades, the challenges faced by the migrants that we're trying to address, and then set out 2 examples of some projects that we have supported last year, as well as one that is in design for next year. Next slide, please. So as you can see from this timeline, ADB support for migrant has evolved over the years, and we have about 30 years of experience starting in the 1990s, very disease specific, HIV, AIDS, communicable diseases. And then in the 2000s, when SARS hit, ADB was very much there giving support. We have a variety of funds available for our less developed countries, and particularly earmarking for health through these funds. And then we have other support mechanisms such as specific projects. The GMS, the Greater Mekong Sub-Region Communicable Diseases Project, was the first one in 2005. A second tranche of that in 2010 to the tune of $27 million. And then we have other trust funds such as those targeting malaria and other communicable diseases. We also have more grant and TAs coming through the 2016, 2017, 18, 19, and our flagship GMS Health Security Project in 2016. In 2020 and 2021, last year and this year, we have had a huge amount of support for the COVID response, the CARES program, which is something I'll be explaining a little bit later on, as well as the vaccine access projects and the Healthy Borders project, which is particularly targeting migrant and mobile populations. A few trends I would like to point out as the support has evolved. The first is, so if you could go back a slide, early on, we seem to have more of a single disease focus, as you can see, HIV, AIDS, SARS, and so on. Now we are moving more towards health system strengthening. And then earlier on, again, we focus much more on bilateral and single country agreements. We are now moving much more towards regional groupings, mostly under the health security lens. ADB's niche and experience, I would say, is longest and best in the Southeast Asia region, which is why I'm concentrating here today on the GMS, the Greater Mekong Sub-Region. This is an area where many outbreaks have originated. It's also a very interconnected region. So this is one of our rationale for focusing so much support in this area. So yeah, in the past couple of years, I would say that we've been moving from a country and disease-centric approach towards a more regional health care for mobile and migrant populations to a person-centric portability approach. Next slide, please. So beyond projects that I've been mentioning and the funds and the trust funds and the technical assistance available, ADB has supported countries to create platforms for cooperation. And one such platform is a working group on health cooperation, which is made up of directors from Ministry of Health from 6 countries of the GMS, who report to senior officials within their countries. And there are annual GMS ministerial conferences and summits every 3 years with other sector working groups as well. And these kinds of groups help to solve the challenges of coordination and trust. They do have a health cooperation strategy, 2019 to 2023, and you can see the 3 pillars there that they focus on: health security as a regional public good, health impacts of connectivity and mobility, as well as health workforce development. And you'll notice the second pillar there really prioritizes the issues that migrants face typically, which is border area healthcare, health system strengthening, UHC, universal healthcare coverage for mobile and migrant populations. And even while the strategy was written in pre-COVID times, these 3 pillars very much resonate today as being critical areas of cooperation. Next slide, please. So there are various challenges for migrants within health and social protection, and you can see some of them listed on the left here. They include things like inadequate health and social protection, access and provision in terms of volume, cultural sensitivity, which was mentioned previously, as well as scope, high out-of-pocket payments, fragmented multi-sectoral response, which means to say that this is not just a health issue, it's very much a border zone issue, an immigration issue, a financial issue, and so on. There's poor data quality and management, especially when you take this across borders, and a lack of regulatory harmonization, which has also been touched upon. So some of these challenges are trying to be solved by ADB through basic infrastructure support, sort of easing the access to culturally sensitive services, especially across and at borders, creating affordable healthcare without undue burden on certain states, especially the hosting states, and then a coherent cooperation framework between governments and other stakeholders that work in and across countries. I'd like to introduce two specific projects that ADB has been working on in supporting migrants in the context of the COVID-19 response. So next slide, please. The first of these programs is called the COVID-19 Active Response and Expenditure Support, or CARES program. And this is a program of $1.5 billion last year for Thailand. The CARES program is one of ADB's most significant and biggest responses to COVID-19. And it's created last year, backed with a special financing window for urgent fiscal support to countries following the COVID shock. The program supports government to finance COVID relief and stimulus packages for the health sector, for social protection, and for business, particularly small and medium enterprises. You can see the program rationale on the left here. Thailand is a country that has millions of migrants, especially from neighboring countries, who have high-risk jobs but are very lowly paid. Yet they contribute so much to the GDP of Thailand, and they also contribute a lot to their home economies in remittances. But with COVID-19, many migrants have been left stranded, homeless, jobless, and in a very precarious health situation with little or no social protection. So this project have the components on the right here, and the impact was intending to address the adverse impact of COVID-19 to mitigate economic growth and poverty reduction. And then the effect of this project was healthcare systems preparedness for future pandemic surges improved and adverse social and economic impacts of COVID-19 minimized. You can see here also the intended outcomes. Firstly, to prepare the healthcare system for pandemic surges in the future. At the time when we were preparing the project, Thailand was fortunately going through a very small number of COVID-19 cases. But as you can see in recent times, this has increased. And we were trying to increase the testing capacity to treatment expense and ensure that treatment expenses were covered, especially for migrant workers, and provide healthcare worker incentives. The second pillar was supporting expanding support for poor and vulnerable impacted by COVID-19, especially migrants. So there were cash handouts to workers not registered in the social security system, and registration of migrant workers who lost jobs into the social security system was prioritized. And we also supported small and medium enterprises impacted by COVID-19 in sectors such as manufacturing and tourism, which are sectors that migrants typically work in. Next slide, please. The second project that we are working on currently is called the GMS Healthy Borders Project. GMS governments have been working together through the working group and other mechanisms to deal with border and migrant health, and not least the aim being universal health coverage for everybody. The project rationale is defined in the left column again. So there is a recognition that GMS governance has some capacity, but there are limitations in how they can deal with border and migrant health. There are definitely inadequate health infrastructure at border areas, and yet regional cooperation is really the key to solving trust and coordination issues. So through projects, through working group, through technical assistance support, ADB is supporting these areas. And then this area, the GMS, is extremely interconnected, as I was saying earlier, and the COVID-19 response has been sometimes patchy, and ADB is trying to fill some of the gaps in response. And through this project on the right here, this forthcoming project next year, Cambodia, Laos, Myanmar to be confirmed, and Thailand will collectively improve access to affordable health services for migrant workers in and around selected border zones. So again, the intended outcomes will be cross-border and sub-regional cooperation for universal health coverage for mobile and migrant populations improved. We'll be doing this by supporting regional frameworks, cross-border activities, and ensuring continuity of care across borders, especially through electronic health records, as well as financial protection, which is something that I think Dodo will touch upon in the next presentation. And the second outcome will be health service delivery and selected border areas strengthened. And this will be really much more about infrastructure improvement, as well as the provision of essential health services and capacity building for healthcare workers. Arguably, this is the first ADB project to consider addressing portability rather than the country or disease-centric approach that we've been taking. So I think this is quite a groundbreaking project in some ways, especially from a health financing angle. Next slide, please. So this is my summary slide. In summary, ADB has a very strong footprint, particularly in the GMS for regional cooperation, integration, and looking after migrants and mobile population. And this is showcased by the strong cooperation for communicable disease control and health security in the region. However, this region is increasingly interconnected and integrated, and more we need to worry about disease and country-specific interventions and move from this to person-centric interventions. Dodo in his slides will give some further technical insights into what these mechanisms and interventions might be. Thank you very much.
Thank you, Asusa, for this very well-rounded presentation and for providing us with an overview of the shift from what you said was a person-centric approach that the ADB had previously implemented to a more regional, person-centric portability approach, not a country and disease-centric, which is very important and which Eduardo will elaborate on further. Eduardo, the floor is yours.
Thanks, Maya. Can I have the next slide, please? And thanks, Azusa, for discussing, in a sense, the challenge that we have on how to deal and ensure health coverage for the migrant workers from Asia. Can I have the next slide? So right now, if we look at the outflows of workers from Southeast Asia before COVID, we have seen that a lot of countries, including my home country and from the Philippines, are actually supplying a lot of the migrant workers, a lot of the temporary migrant workers that we're seeing all over the world. So from the Philippines, from South Asia, from Bangladesh, the numbers have continued to go up in the last decade. Next slide, please. COVID has brought down, can I have the next slide? COVID has brought down the numbers, and this was a nice report that just came out that ADBI with ILO has done, showing that during the COVID, you have actually some of the numbers of migrant workers going down, but it did not stop, okay? So despite COVID-19, despite the pandemic, we still continue to have migrant workers flying out of Asian countries going to either other Asian countries or in a lot of cases, including from the Philippines, India, Bangladesh, from the South Asian countries, the Gulf Cooperation Council countries, and other Middle Eastern countries. Next slide, please. So when we look at, for example, the flow of workers to GCC countries, we have seen that basically nearly all of the 6 Gulf Cooperation countries, Saudi Arabia, UAE, Qatar, Oman, Kuwait, and Bahrain, have been major receiving countries of migrant workers from Asia. Similarly, we are also seeing this trend that other Asian countries, Thailand, Singapore, Malaysia, Brunei, in particular, then of course in South Asia, India, taking on as receiving countries of migrant workers from Bangladesh and Nepal, have become, in a sense, have become also receiving countries. Next slide, please. So we have seen this, of course, that for example, in GCC, and of course, this would have implications now with COVID and the way they're doing the response of COVID, that half of the population of the Gulf Cooperation countries are non-nationals, okay? And a big part of this would be migrant workers from Asia. Next slide. And this is most, of course, clearly the United Arab Emirates is one country, and of course, as we now listen to which countries has been doing great in COVID vaccination, UAE is among those that's been quite reported, where we've seen the expat population, nearly 90% of the population in UAE are coming from our migrant workers. Probably more than half of those are migrant workers from Asia, from Philippines, in India, and Pakistan. Next slide. So it will be interesting. It is really important for us to start to understand, next slide, please, how health coverage are being provided with migrant workers. Okay, it is, ideally you would have wanted that countries would actually, receiving countries would automatically provide the same type of health coverage that they're providing their nationals, or there is portability among countries. And there's actually, in a sense, what we hope to see in the eventually, but we're not yet there. And so as we try to advocate for more portability of health coverage among migrant workers, where you have the receiving and the sending countries probably sitting down and resolving and agreeing to this portability, it is important to us to see where we are right now. Next slide, please. So let's try to look into sending countries, and in a sense, what has evolved in sending countries, and in particular, I'll talk about the Philippines and Indonesia. These two countries, this is countries where I work now. I work in the Southeast Asia Regional Department of ADB, CERD. These countries have adopted universal health coverage policies, programs, which essentially means that everybody, including migrant workers, are part of this new UHC or national or universal health insurance program. In a sense, in the Philippines, Indonesia, this is the mechanism that they have adopted to accelerate to achieve UHC. And basically, what they do is that the migrant worker, before they leave the Philippines and Indonesia, are supposed to be covered by their respective national health insurance program. The Philippines is a little bit more advanced, and in a sense, in the Philippine law, and even before the UHC law was passed in 2019, it's been made mandatory. It's been quite a challenge for a while. You cannot leave the country and work overseas unless you have proof of your payment of premium. I think this has been removed, but the law still basically means that it's mandatory. And similar in Indonesia, but what's the challenge here? In a sense, because both the UHC systems in the Philippines and Indonesia do not contract with healthcare providers in receiving countries, then the only way in which financial coverage can be provided is through reimbursement. And this has become, of course, quite difficult because you have to pay first before then you'll get reimbursement from PhilHealth, or in the case of Indonesia, BPJSK. And really, to move forward into a much more robust coverage, there has to be agreements between the receiving countries, health facilities in receiving countries, that they be paid by the UHC financing scheme or the national health insurance programs of Philippines or Indonesia or other countries that would be adopting this. So to ensure that the worker who is covered, the migrant worker who is covered by the sending country scheme would actually would be protected. We are not there yet. This has been always part of discussions, but we haven't seen this happen. So next slide. What we have seen, and this is particularly in countries in Asia that are receiving countries, are different ways in which they provide health insurance, health coverage or health insurance coverage, you want to call it, for migrant workers. So in Thailand, if you're basically if you have work permit, in the sense you're part of the formal sector, then you're part of the Social Security scheme and the health insurance coverage of the Social Security scheme. So the challenge has always been how to provide health coverage for the informal workers, okay, who are not covered by the Thai Social Security scheme. So for the last 20 years, the Thai Ministry of Public Health has been setting up what was sometimes called the compulsory migrant health insurance scheme, sometimes called the health card, but essentially it's a voluntary prepayment scheme where migrant workers pay a premium. I'm trying to remember how much it is right now. And the Thai Ministry of Public Health has been improving the benefits to the point that it's nearly equivalent to the benefits that's been provided by the Thai UC scheme for the Thai citizens. Now, of course, for the Thai UC schemes, the Thai citizens who are eligible for the Thai UC scheme do not pay anything. That's fully subsidized. Their prepayments are, in a sense, fully subsidized by the Thai government. So this is one, but this is still not portable. This is only something that's provided if you are a migrant worker in Thailand, and this is the coverage scheme in Thailand that we're going to work on in the Healthy Borders and try to see whether this could be improved by having, in a sense, discussions, coordination between the sending countries who work in Thailand, and in a sense, and then improve the coverage of all migrant workers, particularly the undocumented migrant workers, and what Nono says, the domestic, the one who works in households that are sometimes the most difficult to cover, not just in Thailand, but in lots of other countries. Next slide, please. Now, our friends from Malaysia do it a little different. Okay, so they have come out with a mandatory scheme, the workers, not the employers, the workers So similar to Thailand. So the workers in Thailand is the one in Thailand who's paying for your voluntary premium. In Malaysia, they also pay, but it's mandatory. And if you could not renew your work permit unless you pay for this, what they call the SKIPA, the Foreign Worker Hospitalization Surgical Insurance Scheme. Now, the Malaysian scheme basically only provides benefits for surgeries and hospitalization, and does not cover outpatient care. The thinking, of course, with outpatient care, you could just pay with user fees. They recently expanded the benefit package of what's covered by the scheme. It's actually provided, the actual insurance is actually outsourced or provided to private insurers. And of course, in Malaysia, the discussions has been ongoing for quite some time on how this scheme could be sort of incorporated or aligned much more closer with the government, with the plans of government to set up a national health insurance scheme. Now that scheme has not been in place, so this continue to be implemented separately and just in exclusive for foreign workers. Next slide, please. Then in Singapore, basically what you have there is there's a law, the Employment of Foreign Manpower Act, where basically the low-wage domestic workers, the employers, are mandated to provide the medical insurance coverage. Okay, so these are the different schemes, and in a sense, I just described schemes in 5 ASEAN countries, which, if you think about it, are not aligned to each other. So the challenge really for ASEAN is how we could get the sending and receiving countries work together. How to make, for example, the PhilHealth, the PhilHealth of the Philippines, the JKN of Indonesia, become their benefits to be portable as they go to Thailand and Malaysia, to get the Thai compulsory health insurance scheme, the SKIPA in Singapore, the national health insurance scheme that are emerging in Laos and Cambodia, the Vietnam Social Security, the Universal Health Insurance Scheme in Vietnam run by the Social Security Institute of Vietnam, basically to have some part. So lots of talks, but we haven't really seen this move forward. And I think this is really going to be among those challenges that as ASEAN countries, probably we in ADB and CERD, would hopefully be able to respond in the next few months. And of course, COVID has seen as the need for really portability of health insurance, similar to Europe, as what was known as said. Next slide, please. And the set of countries that we also see a lot of portability, the GCC. The GCC countries actually basically, and Maya knows this as well, that if you are a citizen of UAE, you get sick in Qatar, you're covered, similar in Kuwait. So it's a nice example, just like the European approach, probably, and the Caribbean approach of portability of health coverage across countries. And they have, but that this has evolved through the years, and actually the portability of coverage is quite good now. But it's more important for us to look into how do the GCC countries provide health coverage for migrant workers from Asia. So the UAE is probably the most comprehensive benefit. They actually have a national health insurance scheme that requires everybody to be covered, from a basic scheme to a more gold-plated scheme. And I think Abu Dhabi in particular outsourced the running of the scheme to Munich Re. The other Emirates basically run it on their own, but essentially migrant workers are the coverage of migrant workers is a key component of the universal health coverage scheme that UAE has. Qatar is basically adopting what UAE has done, and struggling, of course, with the problem of the coverage of domestic workers, because they're requiring the employers here to provide coverage to the workers, and of course, the households where the employers of the domestic workers did some pushback. But this is a problem that I think that was there about 4 or 5 years ago. Hopefully, I think this has been resolved. I think the expectation, and I have to check this, that Qatar is probably not the level of UAE in the coverage of migrant workers. And Kuwait has also has been moving away from just mandating employers to provide coverage to having a national scheme that provides coverage. Next slide, please. And so is Bahrain. But when we were doing this review a few years ago, Bahrain, Oman, and Saudi Arabia, basically their approach is just mandate the employers, similar to in Singapore. You provide your coverage to your workers, and they don't do an approach where basically, we're going to have universal coverage and everybody should be covered. Okay, so, but things are moving there as well. So in a sense, we look at GCC from 2 levels, a model of portability of health insurance coverage among different countries in a particular region, So something for Asean to look into. And of course, in the way the receiving countries have actually provided coverage to migrant workers. Next slide. Now, probably the question that's probably there is how about COVID vaccination? What are we seeing? Are migrant workers getting the COVID vaccines? Well, it's really dependent on the policy of receiving countries. Okay, so we're not seeing. We probably haven't seen enough in Thailand because the vaccination in Thailand is just starting to really scale up. But in Singapore, for example, they have really, and this is as seen here in the Straits Times report, they've actually made an effort to provide COVID vaccination for migrant workers. Well, partly because the outbreaks that they've seen, the last one, not the current one, actually came out from dormitories. So the sense that becomes explicit policy by Singapore that migrant workers will be covered. Now, in the GCC countries, quite interesting. So I pick up this nice news article from India where basically in Kuwait, the expat rates are complaining that they're not being covered. But we have also know from reports from Bahrain and in UAE that the coverage of the migrant workers has been quite extensive, and they have basically really not been. The vaccines has been provided to migrant workers in these countries and the other GCC countries. So it's too early to tell. It would be, we haven't really seen, for example, what's happening in Indonesia, whether Indonesia has done a great job in vaccinating its nationals. But we have not heard report of any plans, for example, Indonesia to cover migrant workers out from Indonesia in the receiving country. So these are probably things we need to closely monitor. The most we've heard, of course, is that embassy staff and all of that are being from developed countries, from OECD countries, well, from countries in Europe and the US that have vaccines, are basically sending vaccines to their embassy staff and all that. Debates, for example, in Kenya, where the Kenyan government said that UN staff in Kenya can get access, and which raised some questions from the nationals in Kenya that say there's very limited vaccines, so are we giving them to foreigners who are in Nairobi and in Kenya? So these are still ongoing discussions, that we'll have to closely monitor, hopefully we'll see. And what we hope, of course, is that countries will not be discriminatory against migrant workers, particularly the low-income migrant workers, and make sure that the COVID-19 vaccines within the country will also be available to the migrant workers. I think I end there, Maya. Thank you.
Thank you very much, Eduardo, for a very interesting and in-depth presentation. Thank you also for the comparison between Asian countries' health insurance coverage and the GCC model of portability that was implemented. Generally, I think we've received a wealth of information today from the different panelists. We started with Nuno, who's walked us through the concept of portability and also mentioned some of the challenges in terms of the wording of certain legislation when they're exclusionary to certain categories of workers. And also some of the administrative requirements that create further challenges to the actual implementation of inclusive social protection. And also looking at the concept of totalizing contributions and being able to access pensions when you've worked in more than one country for different durations of time. I think that was a very interesting contribution. And then from Nicola and Nook, we got a very comprehensive overview of how migrant workers have been affected in destination countries, but also what measures were destination countries implementing to respond to the increased poverty and unemployment faced by migrant workers, either through social assistance measures or through subsidies for some social insurance measures where they are previously included in social security. And also the point on the importance of looking at policies for the reintegration of migrants when they return to their countries of origin. I think that's a very important point to look into further, and also to question of how such policies might look like, how they can target returning migrants. From the Asian Development Bank in Asusa's presentation. I think it was very interesting to look at the regional approach that was being implemented, specifically in a cross-border health system strengthening approach focused on migrant workers specifically. And finally, I think we saw a lot of examples of that through Eduardo's presentation, where he showcased the differences in the legislation on health insurance coverage in different Asia countries, and also made the important point of highlighting how they are not always complementary, which makes it difficult for portability of benefits later on, or how it's an important point also to raise, because it assists us in finding out how sending and receiving countries can cooperate in the future to ensure better health insurance coverage for migrant workers. Thank you to everyone for sending questions through the Q&A chat. We've had a few come in that are very interesting. And we could potentially start with a question directed to Nicola and on advocacy groups. The question was, are there any noted common key actions needed to move social protection for migrants forward? Or is it too difficult to say? What should be the role for migrant advocacy groups?
Thanks, Maya. I'll come at that question from the back end, if that's all right, in terms of simply the role of advocacy groups. I think the role of advocacy groups is really, really important in this discussion. It's quite often that local migrant support organisation, migrant workers associations, etc., sometimes they're the only sources of data or information on the experiences of particularly undocumented migrant workers, because they, by their very nature, they're not quantifiable in the same way that documented migrants are. I talked a little bit about the importance of capturing and responding to migrant views, experiences and perceptions in the creation of policies as well. And one of the ways in which governments can access that kind of information is often by engaging with intermediaries like migrant workers associations and CSOs working on that sort of support. Those policies need to incorporate their experiences, their challenges and information on those, but also they can provide a feedback mechanism on services and information that's being provided to migrant workers to find out whether or not those policies and services are being effective.
Thank you very much. That's a very interesting point and very important, because the role of local actors is essential to any shock responsive social protection system, but to social protection systems in normal times as well. And as you said, in grievance redress mechanisms, but also in the identification and targeting of beneficiaries at the beginning or at the start of the pandemic. Since you've mentioned undocumented migrants, could you please elaborate further on the findings from the rapid assessment that you conducted specifically relating to undocumented migrants, and what recommendations from that rapid assessment target undocumented migrants particularly?
Sure, but also happy to defer to some of my colleagues who really do focus very specifically on this issue as well. I think, as I mentioned, undocumented migrants, much harder to quantify and respond in that way. So in the rapid assessment, as well as the other piece that we did, we also draw on the information available from local civil society organisations, etc., which is often, as I said, perception data. I think in terms of response, the labour laws are key. I'll, of course, hand that one over to Nuno to respond in more detail, but I think the potential for supporting the creation of documented pathways, migration pathways, so that there are more opportunities to be documented, not have to go on undocumented in order to obviously there's demand and there are skill gaps that undocumented migrants are filling in destination countries. COVID also really illustrates the impact of the importance of access to services for migrants regardless of their documentation status. Access to health services, access to education for children of undocumented migrants, all of these things. I think we are seeing, I mean, certainly in the ASEAN region, I felt that when we did that research, we did see quite a distinct level of recognition of that. And it's one of those ironies of life, perhaps, that it takes a pandemic for people to realize that you can't segment people in quite the way that you might like according to your policies, and something like a pandemic doesn't respond to those categories. And I think that recognition is really important going forward, because it also enables potentially some momentum around increased service delivery for undocumented migrants, and possibly even some addressing of some of the prejudices that they suffer.
Thank you so much, Nicola. Nuno, I was wondering if you had anything to add further to that question, but also if you can tell us perhaps more about what's needed to engage more cooperation between ministries of health and ministries of social protection on portability for better implementation.
Okay, let me see if I can. I mean, starting by, I think Nicola said that, I think she already covered it quite well. And I'm not really like a labor migration specialist, I'm a social protection, but indeed we did recently a study on the barriers for social protection in Thailand, not particularly looking at COVID, just the barriers to access and we saw that, you have different, like you have the barriers indeed, even if you are regularized in Thailand, and you have barriers because you work in sectors that are not covered, your employer might not comply with the law the same way it does for nationals. But we found out that from those who are in a regular situation, actually the level of formalization is almost higher than for national workers. If you look to the full picture on the labor market, it's curious, because probably it has to do with the fact that when they are regular workers, they have some form of legal existence already in terms of labor market, because they are registered in the Ministry of Labor, more than someone who might be working in a company and has no paper at all, and it's more easy sometimes. And the issue is indeed with the regular migrant workers, and Thailand, to bring also the positive element of it, they did a massive campaign of regularization some years ago, and it was impressive the number of migrant workers that they were able to regularize. And many of them, for instance, when it comes to health protection, they have a specific scheme that is also reaching a significant portion of migrant workers. The problem is how you handle. It's very difficult in terms of labor legislation. How do you allow? There is indeed the recognition of the need of workers. At the same time, they don't want probably just to make a policy of completely open, because also of the national debate. It's a very complex. Even when we were talking about the participation of civil society, I was recently in a dialogue, and while we try to keep it technical, from the moment that the civil society representatives start having more an activist position, they were completely right in what they were saying. We got a reaction from the government that was people stop talking from a technical perspective or technical experts from the ministry, and they start talking as nationals from a country that feel they were being accused of something. And this is really something that is finding this diplomatic right balance between the things. It's extremely important, because this is extremely sensitive, and it's easy. We look in Thailand, but it's the same in my own country, in Europe. It's the same everywhere. It's a topic that people are so sensitive to it, and we need to be extremely smart in the way we push it. But yeah, it's very important that countries understand that the more they facilitate regularization, breaking barriers like the costs that are not legal costs, but the cost of using agencies that in the end make people prefer the solution that is not via the formal channels, and instead they use these ways. There's so much that needs to be assessed before to define a policy that really brings people in a regular way and allows them to be properly covered. Oh, the second question on what to do. I think ASEAN actually is doing, I mean, I think it's an interesting process. I've been working on this process for some years. I think it's really the use of multilateral spaces to engage countries in these sort of dialogues are very important, because it's more difficult, of course, let's say for a country that is in less developed, like let's say Laos, to be bargaining with Thailand. But let's say when this happens in a larger table where you have all the countries who have less power, but they are all together coming with one voice and pushing for this kind of agreements and for the interests of workers, I think that's a good approach. I think ASEAN is a very important space for this sort of dialogue. And then it's also, I feel there's a lot of, sometimes countries are afraid of engaging because it's something new. I think it's important to start with small steps, go gradually, understand that you don't need to have a fully fledged portability agreement. You can start by some small steps, and then you build up with time when you start building trust with your partners and understanding better the mechanisms. Yeah, I hope I answered to those questions. Thank you.
Thank you very much, Nuno. On the topic of regional agreements, a question directed to Nuc and Nicola, perhaps, to tell us more about the policy momentum behind ASEAN's developments throughout the COVID pandemic, particularly in relation to regional or bilateral agreements and the guidelines that you have been preparing. Can you tell us more about how prepared countries are to accelerate policy changes and perhaps to make permanent some of the short-term support provided under COVID measures?
No, do you want to take that?
Yes, I can. I thank you for the question. It's I also see another question in the chat box about how the rapid assessment. Sorry, I'm losing the chat now. How also the rapid assessment is kind of being implemented at the regional level. So maybe I'll start with that also. We are actually very happy that we didn't just do the rapid assessment and then it went to the shelf, but the rapid assessment actually helped inform the process of ASEAN in coming up with the ASEAN Comprehensive Recovery Framework, and we contribute to I think at least 5 or 6 recommendations that leads to the concrete regional activity of ASEAN, and this also one of which is also include the issue of return and reintegration as well. ASEAN has a lot of plans to work on promoting effective and sustainable and return and reintegration of migrant workers, and we are very happy to contribute to that the rapid assessment contribute to such kind of thinking. Now, in terms of social protection, I think likely a lot of in terms of pandemic and crisis, a lot of we actually hope to see that the crisis will give kind of not just a realization, but also have people thinking that there has to be something that that the countries do more on in terms of social protection. But in reality, as we observe, a lot of measures has continue to be focused on the nationals and rather than migrant workers. A lot of times when ASEAN talks about the measures, it are usually under the caveat of doing something for migrant worker as applicable or as provided in the existing national laws and regulations. So as an immediate action, we see that each of the ASEAN country will continue to follow what is already provided currently in the parameter of their laws and policy. But going forward, I think a lot of attention will be given to considering more of a guidelines on how to assist migrant workers in time of crisis. Thank you.
Okay, thank you very much. We have received some very interesting questions and got contributions from the panelists. We are almost out of time. So thank you for all who attended this webinar and the panelists for sharing your information and your research. Please feel free to access the recording of this event. And for further reading, it's all on the socialprotection.org website. And don't forget to become a member of the socialprotection.org website as well and join the Asia Pacific Social Protection online community. Thank you very much.